A tough talk to have with your kids, but it could save your child's life. Teens make up about half of the 20 million cases of sexually transmitted diseases that are reported in the country every year, and that number's growing.
In fact, our state ranks 10th in the country. 2 Works For You reporter Travis Guillory talks with one teen who reveals why more high schoolers are needing treatment. Only on 2.
A growing problem.
All of the STDs are at an all-time high
that no one wants to talk about.
Over the last 5 years, among the teenage population, we've had about a 17% increase of chlamydia and about a 36% increase of gonorrhea.
Casey Price, program manager for the State Department of Health's Disease Intervention Services, says 24,000 young women became infertile last year because of untreated gonorrhea and chlamydia. It could be your neighbor. It could be your own daughter.
Anybody that's sexually active is at risk for contracting an STD.
Some may blame technology.
What we do know is that social media does give you access to other people easier so that you can meet up with somebody or arrange casual hookups or sexual encounters with people easier than you definitely could 10 years ago.
And while there's no direct correlation between social media and the rise of STDs, one teen we spoke to said one could lead to the other.
People are seeing so much stuff on social media about like skinny people or people working out or being fit and eating all this healthy food, and so people get so caught up in that and they want to just be perfect and get the perfect guy or the perfect girl.
Do you feel like that leads teens to want to jump into a relationship quicker and then even take that a step further and have sex with that person in order to have a stronger connection like that with that person?
I think I have a couple friends that literally just go find some guy and just have sex and then they feel better.
Do you know any of your friends who are having unprotected sex?
Yes.
And that can lead to pregnancies, STDs. Do you think that teens are aware of the consequences of their actions in situations like this?
I think they know about it. Like, you can easily go on Google and research what it can do for you. But I don't think people know what it looks like or the side effects of it or what can happen to you in the long term. 2 Works For You uncovered that in most major school districts around the Tulsa area, sex ed is offered starting in middle school and into high school years. STD education is a part of that, in some cases even having AIDS education as early as 5th grade. But some think it's not enough to drive the point home. Everyone knows that sex ed is sex ed. Like, you're gonna know what you're gonna hear. But there needs to be like another type of education. I mean, we've kind of went over it a little bit in psychology, but a lot of kids don't take that course because it's very hard. So that's why ads geared toward teens pop up on their social media feeds, like this MTV ad, attempting to remove the stigma attached to STDs and encourage teens to get tested. Whenever they do those campaigns, it's important to let a teen know that they can have confidential testing, because I think that that's one of the barriers for teenagers a lot of times is they are afraid that mom and dad's going to find out, or the EOB from the insurance is going to go back to them or something. Price says it's all about removing the scarlet letter of having an STD and moving forward with maintaining and improving your health. It's just really important that anybody that's sexually active have the test done and find out for sure if they are positive or not, so that they can get treatment to stop spreading it to other people. Travis Guillory, 2 Works For You.